does affect community rehabilitation organizations, does affect workplaces like DoAll and those that are sponsored in the community or affiliated in the community through DoAll. So there is some relevance from a regulatory standpoint. I won't talk too much about the standard. We'll keep it more practically focused. The level of risk that is present in any work situation that I'm familiar with that's structured through DoAll is not as significant as if you were working in a healthcare environment, but there can be some risk, and that's why we go through this. And again, if at any point as we proceed through the program here, if there's a question or a comment, please feel free to let me know that through the tools available, and we'll pause and address it. The language that's on the screen now is from the regulation itself that basically defines the employer's responsibility. And what it means is if you give somebody a job here in the state of Michigan and anything about it presents the risk of exposure to blood or to body fluids, then the employer has to do something about it. They have an obligation to respond, to educate employees about what that risk is, and then provide them with the tools and materials that they need to protect themselves so that risk is eliminated. Some of the terms that are used on a very basic level, a pathogen is something that can make you sick. It's a germ or a virus or a bacteria. It's a disease-causing agent. And bloodborne just means that it can be carried or transmitted in human blood. So when we talk about bloodborne infectious diseases or bloodborne pathogens, we're talking about something that can make you sick, that can be present in human blood. It isn't always there, but it can be, and some other body fluids. But it can only cause a problem. It can only transmit illness if we come into contact with that in certain very specific ways. And those are the risky situations that I mentioned a moment ago and that we'll define a couple of minutes ahead. The three diseases that are bloodborne in nature that are covered by the standard include HIV, which is the human immunodeficiency virus, the virus that causes AIDS that I've referenced already. And there are two strains of hepatitis covered by this rule as well, Hep B and Hep C, focused on, for very different reasons, all very serious health concerns. In addition to blood, there are some other substances that can transmit these illnesses. In the rule, they're referred to as other potentially infectious materials. And these include the body fluids that are associated with sexual activity, the stuff that's in our joints, surrounds our brain, spine, heart, and lungs, and in fact, any fluid that's contaminated with blood. This is a pretty short list and doesn't include some of the other items that you might come into contact with through the course of the workday that do not transmit bloodborne disease, and these include saliva or sputum, unless dental procedures are involved, and that's mentioned specifically because of the risk for blood to become present when they're being performed. And this is as virtually graphic or gross as I'll get with you this afternoon, so forgive me in advance. But if you are assisting an individual with personal care, you got to clean the restroom, or if you're helping somebody who's been sick to their stomach, you need to know that urine, feces, and vomit, while certainly full of all kinds of nasty germs and bacteria that can cause illness, are not capable of transmitting HIV or hepatitis B or C unless they are contaminated, and I mean visibly contaminated with blood, and the same is true of sweat and tears. Having said that, I want to back up to the last bullet point from the previous slide and reinforce the notion that when you can't tell whether or not blood might be present, you should behave as if it is. And in fact, if you're interacting with any blood or any body fluids, it's important to take the same precautions. It's just good infection control material or technique. But behind that, it's important to know the facts, which are these are not capable of transmitting. The certain ways that folks might come into contact with blood or other potentially infectious material, the risky situations, can be broken down into three fairly broad categories. The first is contact with what's called non-intact skin. And the most obvious example of that is a first aid provider stepping in to help an injured worker without putting on protective equipment first. If I, for example, am working next to an individual who cuts themselves, I know how to help them because I have first aid training. But if I jump in and do that without protecting myself first, if I put pressure on that wound where blood's present, and on my hands I have a cut or a sore or a scratch, then that's an exposure that puts me at risk. So that's the first category, contact with non-intact skin. The second is contact with what are called mucous membranes, which is just a fancy term for eyes, nose, or mouth. The example that's cited primarily is a splash or a splatter in a healthcare environment. It's more likely to occur with us through accidental or unintended secondary contact between contaminated gloved hands and the face. For example, if I'm cleaning up after an accident, even if I put the proper protective gear on first, like a pair of gloves, use the appropriate solution to clean up and kill the germs, if before I'm finished I have itchy eyes or a runny nose and I make contact with my face with that gloved hand, then that's an exposure. I put myself at as much risk doing that as if I never donned the gloves at all. And the third category of risk is through a wound from some type of contaminated sharp object. And this is the most frequently occurring type of workplace exposure, usually in a healthcare environment when someone makes a mistake with a needle after either administering medication or after drawing blood. Now, most of us are not involved in either of those processes, but it can happen in other ways, and it's important to recognize that. It's not just a dirty needle that presents a risk, but it can be a saw blade, a razor knife, a pair of scissors, or broken glass that's contaminated with someone else's blood. So these are the three categories of risk. If you get a little bit more specific, and rules tend to do that, this is no exception, there is an appendix or an attachment to the regulation that lists out 32 very specific job titles to whom or to which the regulation definitely applies. And at the top of the list, as you might expect, is healthcare personnel like docs and nurses and EMTs. It also includes first aid and CPR responders, which applies to many of you all. Having that kind of training and that authorization to deliver first aid or CPR in the workplace. It doesn't matter if you're in the shop there or out in the community, at a school, in a store. If you are helping someone who is injured or ill, then at some point the likelihood is very strong that you might come into contact with blood or body fluids. So this definitely applies to you. And you see some other job categories at the bottom of the slide, which we don't traditionally think of right away: barbers and beauticians, cops and correctional officers. It's important to recognize that it does include housekeepers and janitors. Anyone with custodial or janitorial responsibilities, particularly if the area you're responsible for cleaning in a building includes the restrooms, this rule definitely applies. And it also has some relevance to maintenance staff as well. And we don't provide this list because it's necessary to memorize it, but simply to recognize that there can be a broader scope of situations outside the healthcare environment that can present a risk. For community rehabilitation organizations, it is primarily, however, those who are trained and authorized to administer first aid and CPR, anyone who's involved in custodial or janitorial duties, and certainly anyone involved in any type of personal care. The off-the-job behaviors that promote risk, most transmissions of these diseases are non-work related and are associated either with unprotected sexual contact with infected partners or sharing drug, tattoo, or piercing needles. There are also some other risky behaviors that include sharing personal items that might have blood on them. A razor or a toothbrush would be an example of that. And outside the scope of the regulation, but just some good public health information to be aware of, is that transmission can occur from a woman to her baby during the birthing process if she is already infected, if she's dealing with one of these illnesses as a health status going into the pregnancy. And anyone receiving donated blood, like a transfusion, prior to July of 1992 should consult with a healthcare professional about that, because the blood supply was not screened for hepatitis C until that date, because it hadn't been recognized yet as a specific strain. There are all kinds of safety procedures in place now for screening the blood supply, including for hepatitis C, but those who were involved in that process before that date should talk to a doc about it. There wasn't a huge incidence of transmission, so it's not a very significant risk, but it is certainly worth having a conversation with a doctor about. Okay, some common misconceptions that I think most of us have moved beyond, so I'm not going to spend a lot of time on each of these, but they're representative of the kind of casual contact that many of us can expect to encounter, whether it's in the community or in the workplace, that do not routinely present a risk. And in fact, it's primarily in the categories that I mentioned, usually after something goes wrong, after treating an injury or cleaning up after an accident, the provision of first aid, janitorial or custodial responsibilities, or personal care are the primary risk areas. I spend a moment on the signs and symptoms of each of these diseases. This is required content under the regulations, so I need to breeze through this. Onset of HIV is usually accompanied by rapid, unexplained weight loss, chronic fatigue, night sweats, and a proneness to infections like sinus infections because the immune system is compromised and isn't working as well. With hepatitis, symptoms tend to be more flu-like in nature, abdominal pain, nausea, vomiting, fever. With Hep B, the symptoms tend to be more severe. A person feels sicker. In many cases, however, after the symptoms run their course, an individual not only feels better, but there's little recurrence of the disease or any of its symptoms. With hepatitis C, it's almost the opposite. The symptoms tend not to be as severe. In many cases, they don't present at all, so a person doesn't know they're infected because they don't feel sick. But on the other end of that, there's a very high rate of long-term complications and chronic infection, an 85% rate of chronic infection, actually. So in the longer term, hepatitis C, particularly in recent years, has become a growing concern. That's true in part not just because of the nature of the disease, but also because there's preventive medicine available for hepatitis B. It's the only one of the three that's true of. There is a 3-shot series, a vaccine that's administered over the course of 6 months that's been shown to be very safe, very effective, and very long-lasting. Since the serum was introduced in 1982, there's been a dramatic reduction in new infections. It is 95% effective in building up the immunity level of the recipient so that in most cases they would fight off the disease if they were ever exposed. And they have proven to be so safe and effective that they are now recommended by the U.S. Centers for Disease Control and Prevention, or the CDC, basically for everybody. Certainly any adult who's at risk. They are on the U.S. Public Health Service immunization chart recommended at birth through the first 6 months. It's been required of school-age children here in Michigan for 10 or 12 years now, so in a few more years this won't be much of an issue in the workplace because most adults will have had the vaccination if they attended school here in Michigan. I mentioned long-lasting. The latest study that was released indicated that the immune protection level or the antibody level remains sufficiently high enough in a person's system if they respond to the vaccine that it stays effective for 23 years or longer. And it's reached the point where CDC now officially says in print that a booster is neither recommended nor required. So in public health, safe, effective, and long-lasting is kind of a win-win-win. As it relates to this standard, if an individual or an employee is at risk of exposure as part of their primary job duties, then an employer has to make this vaccination available within 10 days of assignment to the task that presents that risk. There is an option to delay that when the only risky situation a person might face is the provision of first aid if it's not their primary responsibility. But many MARO members choose to simply offer the vaccine to folks in that category anyway, and that's good preventive policy. If an employee initially declines this vaccination series when it's offered but later changes their mind, they have the right to do that, and the employer would need to offer it at that time. And if, as well, an employee brings evidence of the fact that they did not respond to the vaccine or a decline in antibody levels, and they are at risk of exposure at work, then the employer would be responsible for offering the shots at that time as well. Okay, we'll finish up then by talking about how you protect yourself. We've talked a little bit about each of these diseases, some of the situations that can put us at risk, and a bit about the preventive medicine or the vaccine that's available. We'll conclude with how you protect yourself. And the main method for protection is really more of an attitude or a mindset. It's called universal precaution, the term most of you are familiar with. It simply means be careful all the time. It's an assumption, really, that all blood and, in fact, all body fluids are infected. You behave as if the stuff is going to make you sick, and then you protect yourself accordingly so that you stay healthy. And you do that before you get involved. And for cleaning up after an incident that was not an emergency, when you have the time and space to prepare for that, it's pretty straightforward, pretty common sense. But as we've discussed in my trainings in the past before, if it is an emergency situation, it can present a kind of conflict of conscience. If, for example, the scenario I described earlier, if I'm working next to an individual who makes a mistake and cuts themselves, I certainly would know how to help them because I have first aid training. But if I were working in an environment where the kit that I needed for both treatment supplies and protective gear were a great distance away, I'd have a choice to make. I could either put myself at risk and jump in and assist that person, or practice these universal precautions to the letter and go away and get the kit, but that would put the individual at risk, and neither of those is acceptable. Now, you certainly can't regulate a person's conscience. There's not a MIOSHA standard that can tell me how I have to respond in that situation. And that's not the point of the rule. The point is to create an obligation or a responsibility for employers to anticipate where an incident like that might happen. And then not only equip employees to respond in assistance or in support of their colleagues with first aid training, but also to make sure that they have, as I mentioned earlier, the tools and materials that they need so that they never have to make that choice between helping someone safely and helping them quickly, which is why in a work environment as large as DUAL, there are multiple kits that are available and should be available that provide both treatment supplies and protective gear. So again, that is not a choice that anyone ever has to make, that they can assist an individual both swiftly and safely. Beyond the concept of universal precautions, there are times when protective equipment, PPE, personal protective equipment, is required, and single-use gloves are probably the most important item. They can be made of a variety of materials. Latex is probably still the most popular, although that's declining somewhat due to the fact that a larger number of employees have skin sensitivity or allergies with latex. And there are a couple of other options as well, a different kind of rubber called nitrile rubber, which is usually a bluish tint, as you see in the middle of the screen, or vinyl gloves, which are quite often clear or green, as you see on the screen there. All are perfectly acceptable. They create an effective barrier, so there's no skin contact. And for folks who are trained and authorized to administer CPR, rescue breathing is being stressed less and less as a part of the process. But it's my understanding that current practice still dictates that some folks with certification deliver both chest compressions and rescue breathing, and if that's the case, then a mask should be available. And a mask that is equipped with two additional safety features. One is a one-way valve that the provider comes into contact with, so air can only travel in one direction from the person who's providing assistance to the person who needs it, and nothing can come back the other way. And in addition, there's a barrier filter that's fitted into the piece that covers the mouth and nose of the recipient. That's two additional layers of effective protection. The other items that you see listed on the screen, eye protection, masks, gowns that are more appropriate for a surgical environment, it's a good idea to have a set of those on site in the event an incident does occur that's very serious in nature. But if you're going to bandage a small cut or put pressure on a bloody nose or even clean up after a minor accident and you dress for surgery, or worse, for a toxic waste cleanup, you're probably going to freak somebody out. And potentially needlessly alarm a person who needs our help. So we don't want to minimize the fact that there are occasions when the full scope of protective gear is necessary, but for most responses, a pair of gloves would be sufficient. After use of protective equipment, particularly with the gloves, we need to be cautious about how they're taken off, because if it's not done with care, we can end up exposing ourselves, coming into contact with our skin, with the material that's on the outside of those gloves that's potentially infectious. When the first glove is removed, it should be pinched from the outside at the base of the gloves, you see in Figure 1, and then slowly peeled back. And when that first glove is removed, it's acceptable to throw it away and get it out of the way. Many of us were taught many years ago to encapsulate that glove within the second so that we have one nice, neat package for disposal, but that can be a bit awkward for folks. And if you are teaching this technique to an individual and that's at all an issue, it's perfectly fine just to throw that first one away. With the second glove, we need to do things a little differently because we have a bare hand. And you see in Figure 3, with an extended finger reaching up under the glove and pulling it out a little bit so that it can be pinched, but from the inside. And then we never make contact with the outside of either glove. That one should be thrown away. They are single use, which means disposable. And then the next thing to do is wash hands at a sink with soap and water. As a rule, with all protective equipment that has been used or contaminated, it should be turned inside out, placed in a designated container. If clothing ever gets contaminated, it should be washed and washed separately in a bleach and water solution. That's what will kill the germs. And after gloves have been removed, and most certainly if hands or skin have been exposed to blood or body fluids, we should be washed at a sink with soap and water and a good scrub, front, back, and in between. Waterless disinfectants that are widely available now, the hand sanitizers, are effective germ killers. They're specifically mentioned as being acceptable in the standard in the absence of, there's not a lot of blood or contaminating material present. And alcohol wipes can be effective as well. But those should be temporary solutions. Again, a sink with soap and water and a good scrub is the best method. When cleaning up after an accident, we've talked about what equipment is important. It's also important to know what material is acceptable for proper disinfection, what's going to kill the germs, and that's one of two things. Either an EPA-registered disinfectant, which simply means it will say on the label, this product kills the germs that cause, or it might say this is germicidal against, and it'll list them out. The different pathogens that it's capable of effectively combating, and you'll see the list there, HIV and HBV and probably several others. And if it doesn't say that on the label, it is not acceptable to use for disinfectant cleaning up after a blood spill. The other alternative then is a mix of bleach and water, and the recommended ratio for environmental surfaces like a floor or a countertop or a piece of equipment is 1 part bleach to 10 parts water. If it's being used as a laundry solution, it can be diluted down to 1 to 100 and still be an effective germ killer. But 1 to 10 is the recommended ratio. If you're cleaning up any sharp objects, please never use hands for that, not even gloved hands, but use tools like a broom and a dustpan, or perhaps tongs or some other device so that you never have to make hand contact with that sharp object, particularly if it's contaminated. If you do have items that have absorbed a great deal of blood, they can't just go into the trash. They become what's termed regulated waste, and that describes an object that's soaked or saturated with blood. And if that's the case, it needs to go into a specially labeled red bag that has the biohazard symbol that you see on the screen on the left. If it's a sharp object, it needs to go into a sharps container, which you see on the right, that you may have observed at the clinic or in a physician's office. The red bags are for objects that I mentioned that are really soaked or saturated. If you have a Band-Aid, a gauze pad, a tissue with a small spot of dried blood on it, it does not need to go into a red bag. It should be wrapped or encapsulated in additional absorbent material like another tissue or paper towel, placed into a plastic bag, preferably one that seals, and then it can become part of the regular waste stream. It can go in the trash. And that's not me saying it's okay to take shortcuts. That comes straight from MIOSHA. This waste category is for items that are really soaked or saturated and would present a risk to others. And lastly, there is a document called an exposure control plan. It's basically a written policy that addresses this MIOSHA regulation. And in it, you'll find what's called an exposure determination, which is a list of the job categories of folks who are at risk. The control methods for their protection that include universal precautions, where hand washing facilities are located, the personal protective equipment that's involved, and how to properly dispose of waste, which we've covered. The Hepatitis B Vaccine policy will be stated there, what the options are for that particular employer, to whom the vaccine is offered and when. And a description of the post-exposure evaluation process will also be present, and that's something that we didn't cover. The most important component of that I can stress is immediate reporting. This will basically describe what happens in the event that someone gets exposed. And again, the most important part of that is to inform your supervisor or management immediately so that it can be thoroughly assessed. If it is an exposure incident under the terms of this regulation, that employee will be sent for care, will be sent to the doctor. And it's important that that happen right away, because if the doc decides that treatment should follow, the treatment options that are available are not as effective if they're not started within just a few hours after the exposure. So not at the end of the week, and not even at the end of the shift, but immediately is when an incident should be reported if blood is present and it comes into contact with an employee's skin. Training requirements under the rule and training policies will be stated in this plan, and this is training that is required of folks when they are assigned to the job that puts them at risk, so there is an initial training requirement, and this is one of the few MIOSHA regulations that does have an annual refresher requirement, which is why many of you have been through this a few times. And there are also very strict record-keeping requirements. Training records, for example, need to be kept for 3 years. Medical records involving individuals who are exposed at work need to be retained for 30 years. And there's also a separate log for injuries. MIOSHA requires employers to keep track or records of work-related injuries. There's a separate document or form that's used for anything that involves a sharp. Okay. If there are any questions or comments at this time, I'd be happy to take them.
No questions? No, I guess there's no questions, Ted. Todd's so good.
We covered the material thoroughly then.
Yes, you have. Absolutely.
All right. Well, thanks very much for participating in this format. This has been very helpful to me to continue with providing what I hope are quality training services without spending as much time on the road, and I hope it was helpful to you. If you have questions that occur to you later, my contact information is on the screen here. This PowerPoint presentation is also available to be downloaded through the MARO website on our safety training page. And the audio will also be recorded, as I mentioned, and available to all employees upon request. And if you are interested in information from the source, from MIOSHA, the regulatory agency that enforces this standard, then their contact information is on the screen as well. So thanks very much for your time and attention this afternoon, and I hope to see and speak with you all again soon. Be careful out there.
Thank you, Todd. Thank you. Thank you. Bye-bye.
Thank you. Bye-bye.